MSF has implemented a groundbreaking HIV/AIDS treatment program in Malawi. The main challenge now is preparing the handover of the program to the Ministry of Health. Ever since introducing antiretroviral treatment to its program in Chirazulu district more than 12 years ago, MSF has been convinced of the need to bring care close to patients' homes.
A lot of fears that people had as far as ARV dispensation and HIV management is concerned, MSF has proved that this can be really handled by the least medically trained people. And ARVs and HIV is not that exceptional. MSF has shown that and has shown the world that task shifting is possible. Now in Chirazulu, nurses can initiate patients on ARVs. They are able to follow up patients, even these patients who never in their life see the COs. They continue to be seen by the nurses.
The program had two objectives: to deliver decentralized care and to simplify procedures so that less qualified medical personnel can treat patients. Over 30,000 people with HIV now receive treatment free of charge in 11 health clinics across the district. Data collection software allows teams in the field to analyze statistics and evaluate the effectiveness of this innovative strategy. Laboratory testing is the latest development in MSF's drive for decentralization. The organization has used unit-aid funding to introduce groundbreaking new equipment at health center level: PIMA, which measures the CD4 count, and the new Samba technology that measures viral load. With faster and easier access to test results, patients can be informed of their health status quickly and their treatment adjusted accordingly.
So instead of having the sample sent to district laboratory, the patients will be tested straight at the health center itself, so they will have better access to the test and they will have quicker results. And therefore, if patients have a quicker result, they will get faster treatment if necessary. They will be monitored in a better way.
Everybody in the car, come on! Big work today, let's go!
Before handing over its program to the Ministry of Health, MSF decided to launch a large-scale survey lasting 3 months in order to assess the program. Epicentre teams selected 25 homes in 165 villages to participate in the survey, the first of its kind. The aim was to gauge the number of HIV-infected people in the district and to find out what treatment they were receiving.
You go and do the introductions.
After introducing the team and the purpose of the survey and obtaining informed consent, the participants were screened for HIV using 2 rapid tests.
Enseromo dzofira ndekuti alibeka chirombo ndeife tinatenga magasano ndikuathira pachoyezera chimene chimukuchionache mukuonapo mizere ngati sonzoti niyo muli bwinobwino mulibeka chirombo ndithudi mwazilandira bwanji mwazilandira bwanji zotsatira zimene ziko mwazilandira bwino ndemupanga chani kuti musatenge
Sino ikawa chikhubi kwambiri kwakasanga basi
If both blood tests were positive, a third test was performed to measure the CD4 count to assess the person's immune status. If this CD4 count was sufficiently low, the team would explain the benefits both of starting antiretroviral treatment as quickly as possible and of accessing the free-of-charge healthcare provided at nearby health centres. The real novelty in the survey was the use of new tests to measure the incidence of HIV infection.
Incidence is the number of new cases in a given period to determine if people who test positive have been positive for, say, 10 years or for 6 months. Until now, prevalence studies have indicated the number of people or the proportion of the population infected with HIV, but we didn't know when exactly they were infected. So we had no idea if HIV prevention programs were making an impact. We need to know the incidence of the disease to establish if the program is actually making a difference on the transmission of HIV. We need to know at a given moment the number of people infected with HIV and how many of those are under MSF treatment. And using this information from incidence studies, we can better anticipate the future.
Having stayed here for some long time, of course the cohort is increasing, so we had to look at ways to simplify. So one of the ways that we said was to build quality, to also make sure that people had easy access to treatment. But another point is also to decongest the clinics. We had to simplify. A third reason for simplifying is to ensure that Ministry of Health staff are able to cope with not a complicated program. They must have a program that is easy to follow.
Well-organised drug distribution is one way of simplifying the process. HIV-positive patients come to the clinic every 3 months to get their drugs. And if there are no complications, they consult every 6 months and have yearly laboratory tests. We call this the 6-month appointment programme. An added benefit is that it reduces the number of consultations the health centres have to provide.
Ndezo sezoti zipitilile zotengera mumene mwani chifukwa ife sitikhala ku nyumbeti ndetu
ndekuti kuchokera lero kuzafika pa 24 Oktoba ndekuti ndi miyezi 6 soyenza kuti adokotala azikuona mpaka miyezi 6 aha nditi muita mukanchima kwa kuindo eti nditi izikwa wandima.
If patients are given either 6 months appointment, 12 months appointment, that means we as health workers will have time again to be doing other things like the family planning and the managing the labor ward and the maternity.
In one health centre, a pilot programme has been set up to provide local support to communities. Designated patients pick up drugs for other patients and distribute them closer to their homes.
Tikudumiseni kuna mwadwa hapo ngati? Simu na dwale. Pa siku imene mnalumpa kumwa mankhwala? Palibe. Mukaona vuto kuthamangira ku chipatala. Monga timeti mapereka malangizo masiku onse. Tedi kupasani mamoto awiri. Chone ngacho kuti awo ndiro. Ndiri ngati atatu eti. Ndiye mkamba kumwa ili. Kena kamukaka mwe. Kaka maliza ndiri.
To simplify even further, mother-to-child transmission prevention, antenatal care, and immunisation consultations for pregnant women and mothers who have recently given birth are grouped together in one single appointment to make it easier for them to attend. This streamlining means that MSF can leave stable patients to the care of Ministry of Health personnel. To facilitate handover, independent days are now a regular feature at the clinics. On these days, the clinics are run exclusively by Ministry of Health personnel, with an MSF programme manager on hand to ensure that everything runs smoothly, answer any questions, and to supervise consultations.
One chair you can put there for patients and one chair for nurses.
Now that Malawi's Ministry of Health is managing antiretroviral programmes in other regions, the focus is no longer to substitute for the Ministry of Health.
Have we got the ability not to build an MSF empire, but to build capacity straight into MOH so that we don't do it, but we will always supervise because we've got the technical expertise, but we look at what they have and we adapt it.
These developments mean that MSF is going to be able to start the handover process. Its teams will continue to care for the most complex cases, such as children for whom the treatment is not yet adapted, and patients with conditions requiring particular medical attention.
No problem.
But the handover will of course bring its own issues, uncertainties and doubts.
If MSF goes, I tell you we are going to, I cannot see any future.
Resources is a challenge, there is no doubt. We're talking about transport, ambulance, facility to cart a serious patient from A to B is always difficult, and there's a long waiting time. HR, I've already said, is a huge challenge. Of course, drugs, but we came here in 2001, we provided free drugs. We set an example. We lobbied, we helped to write a proposal. Global Fund is providing it now.
The staff is needed because especially at the health center level, the health workers are not enough. So with the workload we have at the moment, if we can be alone, I think the management will be a little bit difficult.
We can not expect that if MSF leaves, everything will be moving the way they have been moving with MSF. Because MSF in the first place has been following a system whereby it has been patient-centered. You look at one patient, you look at what this patient wants, and you try as much as possible to meet the requirements that this one patient wants. While the MOH has been already moving with the public health approach of managing the patients, whereby they are dealing with numbers. If numbers, you do these numbers and the outcome is good according to the numbers, that is something good.
Managing patients, it's just an ongoing process. You cannot say that I'm fully trained, that means I know everything. But as we go along, I hope we'll be able to manage these patients successfully. Yeah.
Keeping up to date with developments in the field of HIV treatment will remain key to the programme's success.
You cannot say I understand HIV, how to manage HIV. Day by day you learn a new thing, you never know how it is work.
Akafukufuku anafukula kundituna kuti pali mwai oti munthu amapanga ndulidwe kuchipatala okwanira 60% osatenga kachirombo ka HIV. 60% that 100 mukaitembenuze.
Given the results of studies indicating a reduced risk of HIV infection among circumcised men, MSF has decided to introduce campaigns promoting voluntary circumcision.
Ife cholinga chathu cha ndulidwe nkhani yayikulu imene ndithu ife timapanga ngati tumathamanga mjenzi patalamu ndiyoti tipewe kafalikidwe kaka kachirombo ka HIV. Suza kuti wina lesa amene timampanga timayenera ndithu kuti timuyeze tiziwe kuti kodi.
There are 20 to 30 circumcisions performed in the clinics every week.
Okay. This one. What is it?
When we leave, maybe the standard will fall. But if it was at 0%, and now people are working at not 100%, but at 50 or 60%, is it acceptable? And I would say it's acceptable when it was 0%.
This familiar scene of MSF teams heading off to clinics close to patients' homes is set to continue for some time. Meanwhile, the results of the survey in Tiradzulu attest to excellent results in terms both of coverage and treatment efficiency. Proof of success. Now the programme faces the next challenge: effective handover to the Ministry of Health.